Let's begin with the first section of our topic, and that's the acute bacterial meningitis. And in this section, we will talk mainly about some etiological factors that can lead to acute bacterial meningitis. And sometimes any infections of the nervous system that involve the nervous system can spread to the meninges. Meninges are the coverings of the brain and spinal cord. So these are three layers, meninges, which cover the brain and spinal cord. We have pia mater, arachnoid mater, and dura mater. So when the infection reaches these meninges from any area of central nervous system, it can lead to meningitis. So the acute infection of nervous system is the etiological factor for the bacterial meningitis. Then the other factor, we will talk about some gram-negative bacilli that can lead to meningitis, and also some other causative organism that can cause acute bacterial meningitis. So all these different etiological factors, including the infections of the nervous system, gram-negative bacilli, and some other causative organism we will talk about in this section. So first, the infections of the nervous system. The acute infections of the nervous system include the acute bacterial meningitis. Then we have a viral meningitis, encephalitis, focal infections like brain abscess. So all these meningitis, which can be bacterial meningitis and the viral meningitis. But in this topic, in this lecture today, we will specifically focusing on the bacterial meningitis. So viral meningitis, bacterial meningitis, then we have encephalitis. Encephal is for the brain. Meningitis is for the meninges of the brain and spinal cord, but encephalitis is inflammation of the brain parenchyma or tissue. Then we have brain abscess, which is the focal infection if the abscess develop or formation of pus in the brain. Then we have subdural empyema, presence of pus or abscess below the dural space, subdural, below the dura. We have pia mater, we have arachnoid mater, and dura mater. So subdural is the space below the dura mater, so presence of pus or in that area, which is subdural empyema, is also the infection of the nervous system. Then we have infectious thrombophlebitis, in which the veins are inflamed. Thrombophlebitis, phleb is for the vein, itis is inflammation. So the inflammation of the veins as a result of the thrombus formation. So all these are the different infections of the nervous system that can cause meningitis. Each present with non-specific prodrome of fever and headache. So there is fever and headache associated with these infections of the nervous system. Next, what is acute bacterial meningitis? An acute purulent pus. Purulent is for the pus infection within the subarachnoid space. So we have infection or the presence of pus or purulent infection below the subarachnoid space. Is associated with the CNS inflammatory reaction, leads to decreased consciousness. The consciousness is decreased in patients who have pass in the subarachnoid space, and there is, as a result of that infection, the inflammatory response occur, and this, as a result of this infection, this leads to the decreased level of consciousness. The alertness of the person infected is reduced. There are seizures also associated with the infection. Intracranial pressure in the cranium is increased, and there might be a stroke or paralysis or weakness of one side. So all these are different features associated with the purulent infection within the subarachnoid space. There is involvement in meningoencephalitis. Now, what are the different parts which are affected in the meningoencephalitis? Meningo is for the meningococcal infection bacteria that cause the inflammation of the brain parenchyma. So, involvement in meningoencephalitis are the meninges are involved, then we have subarachnoid space is involved, and brain parenchyma. So all these are different areas which are involved in meningoencephalitis. Brain is involved because it's encephal. Meninges are very commonly involved, which are the covering of the brain and spinal cord, and subarachnoid, which is the portion below the arachnoid layer. We have the subarachnoid space involvement also in meningoencephalitis infection. So these are different structures or parts of the brain affected in the meningoencephalitis. Next, the epidemiology of the bacterial infection, encephalitis, meningoencephalitis, meningitis. So most common form of suppurative CNS infection. The organism which are responsible for this is the Streptococcus pneumoniae. About 50% of the cases are as a result of Streptococcus pneumoniae. So very, very common is 50% is Streptococcus pneumoniae, remaining are the other microorganisms. And then we have Neisseria meningitidis is about 25%. Neisseria meningitidis is very common, again causative organism leading to meningoencephalitis. So it's about 25% is this organism. Then we have group B Streptococcus, 15%. Listeria is about 10%. Haemophilus influenzae type B is less than about 10%, and Neisseria meningitidis again is recurring epidemics. Infections caused by Neisseria lead to recurrent infection, recurrent meningitis, keep on coming again and again, so it's recurrent type. So these are some common causative organisms leading to infections of the nervous system, meningitis, meningoencephalitis. We have Streptococcus pneumoniae, most common. Then we have Neisseria is very common. Group B Streptococcus, Listeria, and Haemophilus influenza type B. These are some common causative organisms of the meningitis. Then we have number of risk factors are associated with the infection. We have pneumococcal pneumonia. If the person has pneumococcal pneumonia, they might develop because Streptococcus pneumonia is common causative agent, and once the infection reaches the bloodstream, reaches the brain, and it can cause involvement of the meninges leading to meningitis. So if there is infection by the streptococcus pneumoniae, like pneumococcal pneumonia, it can cause the meningitis. Then we have coexisting if there is acute chronic pneumococcal sinusitis. Then we have otitis media, alcoholism, diabetes, splenectomy, removal of the spleen, hypogammaglobulinemia. So hypogammaglobulinemia, if the level of gamma globulin is low, this can also cause the risk factor for the meningitis. Complement deficiency. Head trauma with skull fracture and CSF rhinorrhea, when the CSF cerebrospinal fluid comes out of the nasal cavity from the nose, usually as a result of accident, some fractures, injuries, traumas, this can occur. So all these are the associated risk factors that can lead to bacterial meningitis. Mortality rate is 20% despite antibiotic therapy. So 20% is quite a high mortality rate. Even with antibiotic therapy, the mortality rate is still high. Meningococcal, then we have meningococcal glycoconjugate vaccine. That's a vaccine for the meningococcal infection. It reduced the incidence of meningococcal meningitis. There are petechial or purpuric skin lesions show the meningococcal infection. So with the meningococcal infection, with the meningococcemia, usually the skin has rash also, and these are the petechial or purpuric skin lesions are present. Initiated by the nasopharyngeal colonization, causes are the asymptomatic carrier state and invasive meningococcal disease. So in this slide, we are specifically talking about the infection caused by the Neisseria meningitis leading to meningococcal meningitis, encephalitis. This is also associated with the skin lesions. The incidence is reduced by the vaccine available against this infection, and usually it is begin with the nasopharyngeal colonization of Neisseria, and usually the patient has asymptomatic, no symptoms are present, and there is also cause can be invasive meningococcal disease. The invasive disease depends on the invasive meningococcal disease. Once it's invaded, what are the factors that can lead to invasion or progression of the meningococcal disease? The bacterial virulence factor. If the bacteria are more virulent, more capable of causing disease, they are more likely to cause invasive type of disease that invade and cause more serious disease. So bacterial virulence factor is very important. Then other very important factor is the host immune response. If the host immune response is weak, then there are more chances that it can lead to invasive type of disease, and it can have more serious type of disease. host capacity to produce antibodies. So the immune system of the person, if it's not strong, the ability to produce antibodies is weak. So if that is not strong enough, then the possibility of having the invasive disease is more. Also, so antibodies are, what's the function of these antibodies is to lyse or destroy meningococci. So if that antibodies are not producing in enough amount, then the destruction of meningococci is not good enough, so it can cause invasive disease. So as with any infection, two factors are very important. One is the virulence of the organism, and then the host defense mechanism. Both play an important role in the spread of the disease. Deficiency of any complement component also increase the susceptibility of the person to develop more severe symptoms. Next, let's talk about some gram-negative bacilli. So far in this section, we talked about different central nervous system infections, including encephalitis, meningitis itself, and then how they occur, and what are different causative factors, causative agents that lead to central nervous system infections. And then in this now, let's move on to another topic which we will discuss in this section, which was some gram-negative bacilli that can cause the meningitis. Complicate neurosurgical procedures. So the gram-negative bacilli, usually they complicate the neurosurgical procedure that is performed, like craniotomy, opening of the cranium or the skull. Head trauma, which is linked with CSF rhinorrhea or otorrhea. CSF rhinorrhea, flow of the CSF from the nasal cavity and from the ear, or oto is for the ear. So that's any trauma that can lead to rhinorrhea or otorrhea. Causes meningitis in patients with chronic and debilitating disease, in patients who have diabetes, cirrhosis of the liver, alcoholism can lead to cirrhosis also. Usually people who are alcoholic, they are weak, wasted, cannot properly maintain themselves, hygiene is poor, cirrhosis is one very common complication. So all these factors can compete with each other. Then we have chronic urinary tract infections. So all these are the causes of meningitis in patients who are infected with the gram-negative bacilli. Next, some other etiological factors that can lead to the bacterial meningitis. We have infection of the ear, which is otitis, and inflammation or infection of the mastoid bone behind the ear. So all these structures which have close approximation of the brain, any infection in these structures can go and cause the meningitis. So otitis, mastoiditis. Then we have sinuses, infection of the sinuses, which are empty spaces. The infection can also, here in this diagram you can see these are different sinuses, and any infection in these sinuses can also cause meningitis. Then associated conditions due to streptococci infection, gram-negative anaerobes, Staphylococcus aureus, Haemophilus. So all these conditions caused by infection by these microorganisms can also cause meningitis. Enterobacteriaceae, then meningitis complicating endocarditis due to Staphylococcus aureus, Streptococcus bovis. Then we have Hasek group and enterococci. So all these are different microorganisms which can cause meningitis as a result of complications of some other infection. So these are some common other etiological factors. Next, causative organisms. We already talked about some of these causative organisms which most likely are associated with the meningitis. We have Haemophilus influenza type B meningitis, which is rare in children who receive vaccination against Haemophilus influenzae type B. Then in unvaccinated children, it's common, it can cause meningitis. In older adults also, it can cause meningitis. So Haemophilus influenza type B vaccine is available. Children should be vaccinated against this. And once they are vaccinated, the infection meningitis is rare. Haemophilus influenza type B conjugate vaccine is available, which can reduce the risk of Haemophilus influenzae type B meningitis. Then we have Listeria monocytogenes, which also cause meningitis in neonates which are less than 1 month of age. So very young children who develop meningitis is usually due to Listeria. Pregnant women are predisposed to this, and then individuals more than 60 years. So if you see, all these groups are the groups who are low in immunity. Pregnancy also, the immunity is low. In old age, immunity is low, and neonates immunity is low. So Listeria monocytogenes is mostly the causative agent in individuals or age groups who are low in immunity or compromised in immunity. In immunocompromised individuals, so as I said, this is all these individuals, they are immunocompromised. By ingesting food. So Listeria is spread or cause infection by ingestion of food and that is infected with the Listeria monocytogenes. Then we have some other, again, group B, Streptococcus or Streptococcus agalactiae, which cause meningitis in neonates and above 50 years of age. Non-B Haemophilus influenzae is an emerging pathogen also. Staphylococcus aureus and coagulase negative staphylococci cause after the invasive surgical procedure, especially shunting procedures. Complication of subcutaneous Ommaya reservoir. So these are different factors that can lead to the infection caused by Staphylococcus aureus and coagulase negative staphylococci. So it is usually the after surgical procedures like shunting and Ommaya reservoir, usually it can cause infection by the Staphylococcus aureus and coagulase negative staphylococci. So that was all about the section 1. Thank you for watching sqadia.com.